Hello everyone, and we are here at Top Aesthetics on our live broadcast. Let's see, we are live in multiple platforms. Let's see, I think we have Top Aesthetics official on Instagram, Magic Surgeon on Instagram. We have Twitter, Facebook, what else? YouTube. That's awesome. So we are trying out this new multi-platform system for broadcasting our amazing lives to answer patients' questions. Would be nice to know where people that is logging in right now, where are you guys from? Where are you logging in? Because I know you logged in from all over the world. I'm here and I can't wait for my appointment. Amanda, awesome. Well, we are here waiting for you. So, but while you are here on the live, you can ask questions. If you have questions, we can even do some live consultations. We have here on Instagram at Magic Surgeon, and we can do some live consultations. And if you are an existing patient, you can also chime in and show us your amazing results. So we would like to see that. So Puerto Rico in the house. Good evening. How's everybody doing? I hope everybody had an amazing weekend. Miami, that is what else? New Mexico? Yeah, amazing. So we have Puerto Rico, Miami, New Mexico. Let's see what else. I've been in Boston this weekend. Very amazing city. Really, really nice, beautiful, clean. Nice people, definitely an amazing place. Palm Beach is here, Alabama, Chicago. Man, that's awesome. Nigeria. Let's see. I don't see the comments here for use. What is this one? Hold on, that one. Okay. Perfect. I see. Perfect. The other ones are here in the. So we're sorry, we are a little bit trying this new platform. It's amazing, but you know, we are. So here is Atlanta, Maryland. That's awesome. Delray Beach. So neighbors right here. Argentina, my home country. I see you in 2 días, 2 days. Can't wait. That's awesome. Hello, Denise. She's saying hi from Facebook. And then Scottsdale, Arizona. Okay, so since we have people from all over here, we are going to discuss some of the common questions they have. Is people gets worried about this surgical tourism, you know, coming to different cities, a different place that are used to have surgical procedures, and it's good. They should. It's important. Because of that, we have prepared Top Aesthetics and a system that it really caters, so you don't have to worry about any of these things, because it could be quite stressful, you know, having not only to worry about the surgery that you're gonna go through, is also worry about the recovery and where you're gonna stay and who's gonna take care of you and who's gonna do the massages, who's gonna drive you and all that. So we have put a lot of effort and created an amazing system, extremely safe for you. It's one of the things that really distinguishes us from everyone else, where you can actually have everything in one place and on an extremely safe environment with all the proper certifications, not only from the professional perspective, but also the people that is going to be taking care of you at the hotel and so forth. So we have a beautiful hotel here. It's a Courtyard by Marriott in Fort Lauderdale. It's a very brand new hotel with a beautiful rooftop and scenery, located in one of the hot spots of Fort Lauderdale, which is the next hotspot after Miami here, very close to Miami. But that area is great. And so if you come I advise you to come a few days early so you can enjoy the area, go to the beach, and do some tourism here because that area is really nice. On top of that, once the surgery happens, that we will take care of you and we will monitor you very, very closely. We have a system of caregivers that will be with you, will keep us updated about what's going on, and while you're enjoying the recovery in the comfort of your own room at the hotel, where you're also going to get the massages and all that. Let's see. I'm looking at some questions here that are coming in. I'm going to start answering those, but I wanted to emphasize that while you're here, that many of you are from other places and many of you are from out of state, and you don't have to worry about coming to Top Aesthetics because we have all these really figured out for you, and we know you're going to have an amazing experience and we know you're going to have a beautiful result. But also we know we created the safest environment for you to recover. So let's answer some questions. What vitamin I have to avoid? My surgery is the 29th. So things to avoid if you're taking like omega-3 acids, the supplements that will make you bleed are certain teas, ginseng, and then omega-3 fatty acids or omega-3 supplements. Those things you have to avoid it. Now, if you read the packages that we gave you before, it has a lot of recommendations of the things that you have to avoid, and there are some of these things there that you should just pay attention to that. If you're having surgery on the 29th, you are still a few days away from that. Definitely don't take any aspirin, ibuprofen, or any of those type of medications because that will make you bleed. So it's important that pay attention to the information that we give you, and remember you can always check our YouTube channel where we have a lot of information with recommendations about everything you need to know before and after surgery. So for those of you that haven't had surgery, then make sure you check the YouTube channel because there's a lot of stuff. And for those of you that are either recovering now or are in the hotel and you have some free time, make sure you check all the post-op sections because we get these questions all over. When can I start wearing my my fajas? When can I start wearing my stockings? How do I wear the foams? All of that is actually answered in our YouTube channel. So remember to subscribe, give a like to the videos if you can because it will help. And then
voila, great. Now I'm closer than ever. You can see my future here. 65 years old, huh?
65, you look pretty good.
Listen, we're up. I have to kneel down. This is good because if I kneel down a lot, I'll have a big bum and we'll have to get a BBL, right? If I keep doing this.
Have you checked that website? That website looks pretty cool.
Did you guys check the website? Listen, we have I keep looking at the monitor. I'm down here, okay?
Yeah.
I'm looking at the sky. That's the problem. We have the online store, you guys, with really cool, awesome items. And of course,
that's mine.
That's yours, and this is mine. I like more my cup of tea. We have awesome t-shirts, sweatshirts, hats. And you know what? If you give me an awesome testimonial, you get a gift, and I won't say what it is. A little interview sharing your story before and after the surgery. And one more thing. Today we're a little bit tight with space, so doctor, I'm gonna have to take you out of here. Listen, not only that our stay package is amazing because it includes everything and you don't have to worry about anything. I'm not even going to tell you the price if you go solo here to do these things, okay? If you Google in any hotel, like 3 stars, not even 4 like ours, it is very expensive to stay in a hotel here. Here we include everything, and it's a really good deal, the package. And everything adds up. Accessories. This is the bag that we include when you sign up with us. Arnica creams, faja, everything. And the BBL pillow, which is back there. Hold on a second. I should be really familiar with it.
And it's funny because we receive, and it's not the first time it happens, we receive some questions to see if they can sign up for our premium stay package just to stay in the hotel. not to have surgery, just to stay because it's cheaper.
Listen, I didn't get surgery, and every weekend I'm at the hotel, and guessing what part of the hotel I was this weekend?
Yeah, in the pool and the rooftop.
No,
at the bar.
I'm taking a break from the sun because I don't want to look a million years in 2 years. I was at the restaurant
That's
eating the
awesome.
delicious food they have.
Well, they have an amazing gym too.
They have an amazing gym too.
Yeah.
You can work out.
So
But
if your companion likes working out, then definitely they can work out.
It's
You
a-
will not be able to work out after surgery, but you know. while you're staying
there's a
there, but-
person that did that. There's a
yeah.
testimonial on
I
Facebook.
know,
Did you
I
hear
know.
it of John Enrique?
Yes.
He's like, I was working out after they did my abs at the second day. I'm like, the
amazing.
doctor better not
We
hear
do not
that.
recommend that, but
However, you always come with people. I love to work out. For me, it's awesome. Like if I'm at a place taking care of somebody, to release all that tension of like being a caregiver, you go to the gym, boom, to the pool, to tan. I'm there every weekend at the restaurant because I'm a good eater.
That
And
is
you have to
true.
look. You include the BBL pillow. You don't even have to worry about that. Listen, I don't want to brag, but we work in a place that nowhere in the U.S. and I'm afraid to say, I don't know if anywhere in the world they have this system
Wow.
where you get out of surgery and we include this hotel that is amazing and comfortable and clean and nice. You don't have to worry for 7 days if you have an infection, if you have a fever, if something is like
well, I
looks
tell
weird.
you, the regular stories are, you know, somebody, usually the husband or a significant other, usually a guy, taking care of the lady that just had surgery and had to go home. And you know, after lipo especially, people tends to bleed and leak, and you know, it's normal. And occasionally they pass out. They just faint just because they're under the effects of anesthesia, and then also they are a little bit
And because
anemic.
they're afraid. A lot of people are panicking.
Yeah, but you don't just pass out because you're afraid. You pass out because you just had surgery and you have your body's adjusting to a lot
honey,
of things.
listen, I have passed out for a lot of reasons in my
Well,
life.
let me tell you,
okay?
the ones who pass out are the significant others because they see leaking of blood, which is not really blood, you know, and then the lady pass out, the guy pass out.
And then it's
a
a real
dangerous
mess.
situation. And then they end up panicking. They call 911. They go take them to the hospital for nothing. They end up with a bunch of studies that they didn't need, the bill that they didn't need. So
I'll tell you a really short and
avoid
sweet
that.
story. I went the other day to the hotel to finish the interviews that I start in the morning here when you come. And the patient was very worried. She had like a little big scar, like a lump, a scar underneath her big scar. She had something there. I don't know what it was because I am not a doctor. And I said, how long are you staying here? She's like, I'm staying 4 more days. I said, you shouldn't worry. The post-op team will take care of you. The doctor comes and does visits to the hotel. You're covered. She's like, you have no idea what peace of mind it is to be here and be worried about something. And I know that there's a whole bunch of people and a team looking after me. You don't want to be worried after surgery, you guys. I can guarantee you that. You don't want to be scared if something is wrong. You want us to have us here at least for 7 days. There are people here that extend their stay for 3 more weeks. Think about it.
Awesome. Well, we have some. Here is thank you for all the love. Thank you, Denise. Thank you, Anna. We're really happy that you guys are happy and are safe and are enjoying your results. Ultimately, that's all we really care about. And we know, patients are very appreciative, in terms of what we do. But they, if this is your first time exposed to this, you will know any better or worse, But if it's not the first time that you're undergoing a surgery or a plastic surgery or an elective procedure, and you have this experience with us, that's where really people can appreciate the difference. And I tell you that we had nothing but like good experiences, like good reviews about that whole kind of journey that we have prepared for our patients. And this is because they had lived other experiences that were not so good. Let's see. I have esto es en español. Hola, tengo el paquete de Mami Makeover. Mi pregunta es que si van bien incluidos son los Gummy Bear. Ok, ¿qué tipo de implantes? Nosotros usamos los mejores implantes en el mercado, tanto de silicón como de salina, y los de silicón sí, son los compatibles similares a los del Gummy Bear, porque lo que tienen es el gel cohesivo, es ese gel que es sticky, que no liquea. Entonces sí, son esos los implantes. Y definitivamente, si puedes chequear el video que tenemos en YouTube, te va a dar la explicación de qué tipo de implantes son. So we are using, the type of implants that we use here at Top Aesthetics are kind of the highest level that is in the market here. We use both saline and silicone. My preference is silicone implants, and the implants that we use have the sticky gel. The gel that is a little more sticky, so it's less likely that it will leak, especially if the implant breaks. So it's actually great, and the feel is also very, very natural. Okay.
Okay, wait.
What?
And this is a question that I can respond because thank God I didn't stay to be a doctor. I never will. Although I fixed a lot of broken hearts. Okay, they're asking, what does the premium stay package include? I'm going to go over this again, and it's important that you get it, understand, because if you pay this on your own, separate, it will be a fortune. I can guarantee you that. And you can Google how much is a lymphatic massage. The 7-day, 6-night stay premium stay package includes 3 lymphatic massages, transportation. Mind yourself, you don't even have to call an Uber with us. Transportation to and from the clinic and the hotel. It includes 2-day recovery assistance, so you have somebody there that is on it. What do you need? Where you go? Everything, okay? And then you have an amazing pool, a restaurant inside of the hotel, and you have 1 visit from the doctor and the post-op team that is always taking care of you. All of that is included in your package. The hotel is a 4-star. I am a very picky person. Sometimes I don't travel anywhere around the world because I hate the hotels and how dirty they are, and I'm like, this place is slick. It's clean. You can lick the bed. There's not even nothing coming out of it, okay?
Don't lick the bed.
I won't, but I'm just like, it's a way of figurative speech. Like, it is amazing how clean it is. Honestly, the furniture is beautiful. The carpets are new. And actually, it's a hotel that has been open not many, months ago. How long has it been open?
Probably less than 3 months. But anyway, yeah, so it's very new. And it's great. They have amazing... people gets really, really good experience when they do it. And the rooftop, yes, that's there's a rooftop and it's nice. Here Denise is saying in Facebook, the hotel is absolutely beautiful. Anyone that does the stay package definitely needs to make your way up to check out the rooftop and the pool and the view from the roof. And everyone at Top Aesthetics is amazing. Any questions I had, they were quick to answer right back. Thank you, Denise. Thank you. So yeah, so definitely patients are enjoying the experience at the hotel with the premium stay package. What is the difference between extended tummy tuck and tummy tuck? We explain this. We have a YouTube video that explains all the different tummy tucks that we perform, so usually it's related to a BMI and your amount of skin excess that we have to remove. So the actual incision is slightly longer, and we have to do usually a little more lipo and so forth. So these are pretty much the difference is the extent of liposuction and incisions that we have to do if you are on a higher BMI or have more skin excess. So if you're local, do you need to do the hotel? That is a great question. Yes, you have to. Let me tell you, you want to. You really want to, because anybody that's going to be taking care of you at your house, especially if you do a combination of procedures, it's going to have a bad time, and so will you. If you are staying with people that are not used to doing this type of care, it definitely recommend you to do the stay package. In fact, most of our patients do the stay package anyway, even if they live, right next door. Most of our patients are not from here, but the ones that are still stay at the hotel because it's so much easier. And remember, you probably, if you're local, you might not want to stay the whole 6 nights, 7 days, but you definitely want to stay 2 or 3 days after the procedure, because that's where you get your massages, and that's the most critical time. And remember, we monitor the whole thing. We monitor you, we monitor your vital signs. I get the vital signs notifications in my iWatch here, so I'm getting notifications right now. Was from the alarms, but I'm getting notifications from the patients in vital signs here, when they send me the vital signs once they leave here, and I get notified when the patient leaves the facility, when they arrive to the hotel, and then everything else. So it's really very, very comprehensive, things that you will not find anywhere. So the premium stay package also includes breakfast for 1 person. Yes, so also that is included as part of the stay package. I am 60. Can I still get surgery? Yes, of course. It depends not so much in your age, but in your health. So send your information remember that the best thing to get both pricing and see if you're a great candidate for surgery is just to submit your information. And your information, you have it right there, topaesthetics.com. You can go to the free consultation. You can also click in the links in our bios and the Instagram page, or also in the Facebook. And ultimately, you can just DM us, send us a message, and we'll send you the link for you to send the information. It's very, very easy.
Is the breakfast included in the Premium Day package?
Yes, for one person. Yeah, I just said that. Positions after BBL and tummy tuck. Yeah, we have also videos about positioning after surgery. So I'll invite you to watch the videos in YouTube, subscribe to the YouTube channels. But if you're having the BBL and a tummy tuck, which is a very common combination we perform, you have to sleep on your back. And the way you do that, not to just damage the results from your BBL, is by putting support underneath your thighs and underneath your back, so it can offload the pressure from your booty. You don't have to be completely floating, but it's good that you don't put all the pressure on your booty, especially when you're laying down. But you're having a tummy tuck at the same time that you will need to be on your back, so definitely think about that. If you guys have some beautiful results to show, feel free to send us some live, and we will invite you here to come in and show us your results. And let's see, can I have folic acid? No, you should take folic acid. No, you can, you should. Folic acid helps a lot with the blood regeneration. So iron and folic acid are very important, especially after your surgery, but you can start taking it before your surgery. So yes, definitely take folic acid. What kind of food should I avoid after tummy tuck? After tummy tuck or any surgery in particular, but you should try to probably lose some weight, which is never a bad idea. And then you should thinking about a high protein diet. High protein diet helps a lot because you're going to need high proteins to heal. So, and then try to avoid things like are salty, a lot of salt, because you want to get rid of the swelling and the salt will retain fluid in your body. You want to also avoid things that will damage your stomach. Remember this, things that have a lot of sauce, things that are very greasy, you will not be able to eat, especially for the first few months after the tummy tucks, you will not be able to eat the same way. You're gonna get full really quickly, and this happens because the pressure in your tummy will make you feel full very quickly, which means that you could experience some sort of this backflow from the stomach. It's called the reflux, and if you do have reflux, it might make it a little bit worse. So make sure that you don't eat anything that is irritant. Avoid chocolate, coffee, kind of all the good stuff, but just for a little while. And that is so you don't get a lot of gastritis or esophagitis or things, kind of these reflux problems. When can I pick up my 1-year-old son after surgery? I'm getting a mom makeover. So we always say that try not to lift anything heavier than 15 to 20 pounds for about 6 weeks. So for about 6 weeks, try not to lift anything very, very heavy. And a 1-year-old kid might be heavy enough. So be careful. Be careful with heavy liftings. And sometimes you're gonna feel really good, really quick, especially if you have surgery with us. So be very mindful. You're not ready, and your tissues are not quite ready, and you could develop issues like a hematoma or bleeding or things like that you definitely don't want. And this applies also for breast surgery. So you be very mindful about things that might injure you after the procedure. What causes the hardness of the abdomen after lipo? How do you treat it? Lymphatic massages don't do nothing. Well, lymphatic massages, you have to. The massage word is more like just lymphatic massages. Post-operative massages are a little bit different than lymphatic massages. Lymphatic massages help. And yes, they do something, but for what you need after surgery is the post-operative massages that will help with that, soften down that fibrosis that happened after lipo, and the hardening happens because of the fibrosis. So to understand a little bit of the healing process, it's a process, right? And you have different phases. And at the beginning, there's an inflammatory phase of where the injury happens, and then there's a proliferative phase where the proteins are putting the good stuff to heal, and then there's a remodeling phase that happen after that. That whole process takes about a year, where the first two happening during the first 6 weeks. So, during those 6 weeks, there's a lot of stuff that your body's doing to heal. So bringing in a lot of proteins and substances and enzymes and getting things to heal. So that's why it gets hard. Once this proliferative phase is done, then you move into a remodeling phase, which is usually about 6 to 8 weeks after surgery. And that's when things start softening down. So it's a process. Trust the process that we always say. And that process will get you, if you do the right stuff and take care of yourself, will get you to a great outcome later. So your tissues will start softening after 6 to 8 weeks, and they will continue to soften for forever, but usually for about a year time. So that's why it gets hard, because your tissue is healing, and it has to bring a lot of stuff to help you heal. Let's see. Antibiotics given prophylactically. So we'll give you antibiotics, to prevent definitely infections. Is edging an additional procedure? Do you recommend it? So it definitely, to create the definition of the high definition liposculpture or edging liposculpture, yes, there's extra work to do that. You can do just even liposuction, but then you can really pay attention to those areas in order to create, for example, definition for the vertical lines in the women, for the six-pack in the guys, and things like that. So it does take more meticulous work and extra work to do that. We like to include that when you do J plasma. So if you do the J plasma, we'll definitely include the edging into that, because that's what the J plasma is great for, and it helps, so it definitely helps a lot. And yes, the edging liposculpture, it's included with the J plasma, but if you're doing just plain lipo, you can request it as well. Let's see. Let's see. More questions. Can I do a breast augmentation on a BBL? Yes, of course you can. Hello.
Hello.
How are you? Look at you.
I'm 5 weeks post-op of a Mommy Makeover Plus.
Amazing.
SDL. I don't know if you'll be able to see it from here.
Yeah, we can see it. That's awesome. 5 weeks, huh? Yeah, if you walk out a bit, wow, that's amazing. And you had a fleur-de-lis tummy tuck.
Yes.
Amazing. So, can you explain the patients what that is? And you look fabulous. We like to show your before, but you look amazing.
There we go. That's better.
Yeah, look at it.
Goes from here and then down to the bikini line. It's because I had lost some 80 plus pounds. I had excess skin, and you said that would be the best option. And so it definitely has given me a lot more shape.
Your waistline is amazing, and I guarantee you that you will not have that waistline if you wouldn't have done that procedure. That's. Yeah, absolutely. The advantage, massive weight loss patients like you, I know this is patients that lose more than 50 pounds or so, they really get this amazing benefit from having this and you are 5 weeks only, right? So that incision that right now is red and it's kind of obvious, in a year will be your skin color, so you can barely see it. But your overall body shape, it's like literally it wouldn't be like this. You're still gonna have a little bit more soft skin or loose skin or flaccid skin in your tummy, and your waistline will not be this small.
Yeah, I'm very happy with it. And then to get the Expro, I had no problem walking upright after.
That's amazing. You have a lot of procedures. Your breast, your fleur-de-lis. You had also fat grafting, right?
Lipo on the back, BBL, did all that.
That's amazing. That's awesome. What do you think about the hotel?
I like the hotel. It was nice. We went up to walk around the pool area. My husband tried to get it. I was like, I'm not sitting out here. I couldn't get comfortable to sit on the BBL with everybody out there. But the pool is very nice. The hotel's nice. The food was good, and the nurses.
Since you came with your husband, right? What would you think if you would have gone home with him after this procedure?
I don't think he would
I
You're
know.
asking her, how
There,
did she sleep?
there are the little details, that you don't realize, even about just that, just having stuff leak off your incisions of your, obviously, when you have lipo, that's normal, but people doesn't know it, they don't know that, and especially.
I'm like going to the bathroom all of a sudden. I'm like, what is all this stuff? Where's it coming from?
No,
You're
it's
asking her, how did she sleep?
they're asking, how did you sleep?
I slept very well in the hotel. Very well. Like with the BBL, I had pillows propped up behind me, and I slept on the bed. And my husband could have slept in the same bed, but he slept on the pull-out or the couch,
Yeah.
main bed, whatever pull-out bed it was. And then I have a bed that goes up and down in my own house, so I just use that. And I also borrowed a friend's lift chair who had a mommy makeover. And so when I couldn't get in my bed, I slept in the chair that lifts you up.
That's awesome.
They're asking if she can show the BBL.
Yeah, they're asking if you can show your BBL. Can you walk back a bit?
Not much to really show.
I know. That's good. Amazing. You know what? Yeah, that's awesome. Look at your waistline. So there's something that we say, the waist to hip ratio. It's so much nicer. When your waist is smaller and now your hips are a little bit bigger, and that makes a huge difference. And that's why we recommend the fat transfer. Not necessarily to make your booty bigger. It's just mainly to give your shape, get you a better shape. Because sometimes when you increase the hips a bit and you remove the fullness from your waistline, that alone is such a difference. It makes, and you look fabulous. You look amazing. 5 weeks.
I'm happy with it. I don't think you did anything to my hips because you're like, you have enough hips.
Good. But also patients that I have never even injected nothing, right? We just did lipo, and then we did this procedure or a tummy tuck. The reduction on the waistline makes their hips and the booty stand out, and they the significant others or their friends think that they had a BBL done and they didn't. It's just interesting. But thank you so much for tuning in and sharing your results. You look amazing. I'm really glad to see. Yeah, you're doing awesome. Keep up with the follow-ups. Remember, we're gonna be sending you the request for photos, and we will do the before and afters for you, and keep sending it to you. So you'll see the progress.
Sounds great.
Thank you. Thank you so much. Thank you. So this is that's a big procedure, by the way. So she did a fleur de lis tummy tuck, which is that specialty tummy tuck to remove all the excess skin from the weight loss from the center of the abdomen. And the patients who need that really benefit from that, and also it creates an amazing waistline. So it's really, really nice to see how. And those are, obviously this is not tummy tuck 101. Those are advanced, and to make those procedures look great takes some experience. So for breast reduction, do you choose the size, or is this something that the patient decides? So we really try to get closer to your desired size. The best thing you can do as of any surgery, obviously any breast surgery and also BBLs and so forth, remember to bring your wish pics. Once you bring your wish pics, we can actually try to understand what your what your goal is, and then try to get you the closest to that goal. Sometimes there are anatomical restrictions, sometimes there are like skin quality restrictions. A lot of times the patients, the skin doesn't stretch as much as we would in order to give it a more, let's say, rounder look on the BBL or so. So we have some limitations because of the patient's anatomy and tissue quality. But we try to do our best to get you closer to your ideal. Now, when you pick your wish pick, be reasonable. Don't bring me that 22-year-old, 20 BMI, super skinny lady that was gifted with huge hips, and try to pick somebody that meets your frame, meets your BMI, that's similar. We have tons of cases in our Instagram that you can pick from, with different BMIs and so forth. So to try to look for people that is in the same tune, and then we will try to get you the closest to your ideal wish pick. Let's see. How do you prepare meals staying at the hotel? So you should not prepare meals while at the hotel. The hotel will include your breakfast for one. But then there's things you can bring stuff, and we will give you a little grocery shopping, kind of list. We have it also listed in our Instagram, and I think it's our highlights as well, so you can check it out. But then bring some stuff, but you can also get stuff from outside. You can buy stuff here or Uber Eats or any of those things in order to do that. So that's in terms of meals while you're here. Do you routinely stitch diastasis recti during tummy tuck? I don't remember any tummy tucks that I have done that I've not done the muscle repair, which is what your suggestion. Yes, definitely. Every tummy tuck, extended tummy tucks, circumferential tummy tucks, and also fleur de lis tummy tuck. All of those get diastasis repair with suturing of the muscles. Do you do tummy tucks without abdominal muscle repair, just to remove the skin excess from the skin? Yes, we do also what we call mini tummy tucks, but this is reserved for a very small group of people. Most of patients that either probably have not been pregnant before, maybe have lost some weight, and they have some excess skin on the bottom of the abdomen, kind of below the belly button. So in those cases, we can do the tummy tuck without doing the muscle repair. It's just removing only the excess skin below the belly button. And we don't also remove your belly button or touch your belly button or reconstruct your belly button like we do during tummy tucks. Let's see. So Jess says, I'm not doing the premium stay package, but I'm staying at the same hotel. What will post-op and appointments be like? Well, see, that is it's bad idea. Sorry, but we cannot offer you any of the post-op services, even if you're staying at the same hotel, because we are committed with personnel to take care of the patients that actually are staying with us using the premium stay package. So we don't have extra people unless we can program that and plan for that. So I do not think that's a great idea. I'm not sure which procedures are you having done, but if you're staying with us for a week or so and you're having a combination of procedures, I will really advise you to do the premium stay package, because it's going to include things that you will need and we will not be able to provide you with that. Okay, so yeah, very, very important. Let's see. Let's see here. When is our next special? I don't know. Stay tuned. Can't tell you that. I don't even know, but it at some point, pretty soon. When is your? I have 3 C-sections. Can I get a tummy tuck with no problem? Yes, often. Most often, the patients have C-sections when they get a tummy tuck, and it's great since we have we will remove your incisions from your C-section because the incision for the tummy tuck is lower. So definitely, it's a best way to get rid of those C-sections, incisions, and to get rid of all that excess skin that you have in the abdomen. Dr. P, if tested positive for COVID a week before surgery, how long do I have to wait? It's best to wait until you test negative, so that's our recommendation. So keep testing yourself. Hopefully you will test negative, within the first 10 days or so, and then we can definitely proceed with your surgery. Hopefully you don't have many symptoms, but again, if you test positive, we don't know how soon have you gotten it and if you're gonna get sick or not. Some patients still get kind of sick, so we don't want you to be sick during your recovery process. So wait until you test negative and then let us know and we'll definitely help you out. Okay, what's the BMI required for mommy makeover? So mommy makeover, if it includes a tummy tuck, then the BMI required for that is usually less than 32. But again, the BMI question is always here, and remember, it's a case by case basis. So it depends a lot on where your fat is located in your body. So just send us your consultation and we'll tell you if you are a candidate for that. Let's see. Denise has a question. 9 months post-op today. Everything is great. My pain, surprisingly, from what I had done, has been very minimal. That's amazing. on my left side, right under my ribs. There's a few days I had extremely sore. Okay, this is very common on patients that have mommy makeovers or breast surgery, and sometimes the patients develop some rib pain, and it's a lot of times just because they had been doing some. This is common after surgery in the first few months because patients do things a little bit different, especially if they had like breast implants or so forth, and they create little micro injuries inside on the muscles or even the ribs and the cartilage that might hurt. So be mindful about your activity. You can take some ibuprofen, if you're in the postoperative period, and then that should be, you should take care of that or those symptoms. Let's see. I suffer from migraines. Are the drugs you use bad for that? No, actually, the drugs that we use are not bad for that. But now, we don't want you to be taking a lot of narcotics. So the narcotics might make your headaches a little bit worse. So anything you can do to avoid taking on narcotics is great. So we will here, recommend you to take the Tylenol and the ibuprofen, both of which will make your headache better. Now you can keep taking your medications that you take for headaches usually, and then try to avoid the narcotics. And if you're having a tummy tuck or you're not great with pain, make sure you get the Exparol because that will decrease the amount of narcotics that you have to take, and that's a great idea. If I get a facelift, do I need to stay at the hotel? Well, it depends on first of all, it depends on where you're from, and it depends, the question is, yes, you stay at the hotel, but maybe you don't need to stay the full 7 days. Now, remember that for facelift, especially if you're coming from abroad, we take about 7 days to remove your sutures. So it will be great if you can stay with us here at the hotel. You will be cared for, and then the first week is when, especially after facial surgery, you get very swollen and some bruising and all that. So if you hide here for a week in the hotel, it's best. And then by the time you go home, we can remove everything. You can remove your stitches, and if you're doing your neck too, sometimes we leave a little drain that we will definitely remove 2 or 3 days after the procedure. So my advice is, yes, you should consider doing the hotel as well, even if you're having a facelift. So by the time you go home, you have no sutures, no drains or anything. Doc, we take the drains at home. Patients are always worried, and the drain question always comes about. We only use drains usually for like tummy tucks, and we usually use just one. It's very simple to take care of them. It's very simple to remove them. We will guide you even through the phone if you have to do it. We will teach you anything you have to do. Remember, if you're getting massages somewhere, you can always have the massage therapist remove it because they're usually used to do that. And you can go to your PCP if you don't live here, that they usually help with that as well. But again, it's really not a problem. Usually has not been a problem, and we'll guide you through that process. Pubic lift done with tummy tuck. Yes, tummy tuck includes actually the lift of that pubic area that usually falls down from the weight gain and loss and the pregnancies and so forth. If a person has dense breast and it has I had 2 prior lift with no implant, is it possible to do a 3rd lift? Yeah, I mean, it is possible. It's obviously more complicated. We have to check your case in particular. We have to see your pictures. I will likely recommend to do the mesh, so you don't have to come for the 4th time. But it's definitely something we could check, and see. Yes, it's possible. I mean, I imagine there's a limit of how many times you have to, can do certain things. For example, lipo, it always creates scarring, so you don't want to go do, lipo 10 times. But we have done it 2 or 3 times safely, But again, each patient is different, so that's why we evaluate everyone. How does anesthesia work with somebody with asthma? It works great if your asthma is under control and you're a good candidate. We'll take care of. We have a huge, like a really, really good preoperative process. Sometimes our patients get a little annoyed by that, but it's very important.
Can I have a sip of your awesome thermos bottle? How cool is this? Where did you get it?
Wow. I'll tell you where you get it.
Where do you get it?
Right
Tell
here. See, Top Aesthetics/store, and then we put it right there for you to see. You go there, you can get one of those
QR
lovely
codes
mugs as well.
It's
Yeah.
really cool. A lot of there's
What is it?
hoodies.
Let me see the QR code. What does
Yeah, I don't know. What does this do? Tell me.
Let me see. Let's see. we see that. I'm gonna click that. Oh wow! Look,
Wow.
amazing.
We
So
took you
see,
to the website.
you can go here, go to free consultation, the first link, and that's it. It's easy to send us a consultation.
And guess what? There you go. There, it's
There you go.
closer.
Here, a little
So
closer here.
guess what? So you send your online consult there, and it automatically it gets to the doctors. You choose the doctors. There's 3 of them. They send you an estimate with the procedures. They evaluate everything: your BMI, your pictures, what do you want to get done, your age, your health. Now, what happens if you're a good candidate? You will be designated to a coordinator, and that coordinator will be your coordinator for the rest of the process. Now, the coordinators here are awesome, and they take care of you from the beginning to the end. But here's the thing, a lot of you guys write to us like, I didn't get the estimate back, what happened? Check in your spam, first of all. If you don't get it there, contact us through DM. We're always responding to a bunch of messages. We contact the coordinator and tell them to get back to you. Your coordinator is your best friend. She will try to help you through the entire process.
Yeah.
Any doubts you have, any worries you have, you just call your coordinator and ask her, hey, I'm concerned. The surgery's about to come. I'm not sure if I lost the weight or this or that. Whatever you have to ask her, she's there. Once you do the clearance, which takes approximately 1 month, you have to calculate all this. You guys were asking, how far are you booked? Well, we can squeeze you in. That's not so much the problem, but you have to send a bunch of labs, and sometimes it takes even more than a month. You must be asking, why so many labs, right? Well, because safety is our priority for us. Am I good there? Okay, we're going to dance tango if I continue like this.
That's right.
So, so keep in mind that you have to send all those labs. They have to be authorized through your insurance, all the labs that you get done.
Yeah.
Then after that, you're clear, you're good for the surgery. Remember, if you want to do a booking with us, I don't want to forget to say that. You just put $500 down. It's non-refundable, but it goes towards your surgery. And the awesome part, if you don't have the money right now, if you're struggling, you're going through a divorce, you sold your car, whatever is going on, but you want to see yourself nice and good, because confidence, we all know, ladies, that is the most important thing, to feel confident about yourself. I mean, I can tell from my own experience. You keep laughing, huh?
No,
That's what
saying,
it
you know.
Listen, I want to say this. Confidence is the most important thing. You sign up with us, you have a full year to get the surgery done. I mean, you can't pay it right now. We have Care Credit, we have Alphion. You can pay it, you can do payments, or you don't have to pay it, and you pay it only 21 days prior to your surgery. Remember to get the premium stay package. I cannot stress enough to say this. People were saying, what if I don't stay? I'm local. Listen, you guys, you don't want to worry about this. The premium stay package includes 3 lymphatic massage, 2-day recovery assistant, transportation to and from the clinic. If you add up all those things, I promise you that it's probably going to equal the same, but you're not going to get the stay if you pay it on your own out of pocket. We have an awesome deal here.
Yeah.
We are the only clinic in the world, is that too arrogant about me saying that, that has the stay premium package after you get surgery with us.
Well, with all of these things that we include, yes, definitely, you know.
Definitely.
And the level of care and the level of, you know, monitoring and all of that really doesn't have a price. And yes, you know, we can only, we put a lot of effort into that to make the safest experience. And I hope you get to enjoy it and to live and take advantage of that. If you don't, then you're just gonna, you know, have great results, but the process after surgery might not be as great, you know, as it would, like if you take advantage of everything we have put together.
You're asking, what is the part of the clearance?
Well, you know, the clearance it's a process, so it has many steps, and it depends on your basic health. So patients that are older or have more medical problems require more stuff done. Patients that are young and healthy, they require just basic stuff done. But we will tell you everything you need to be going through surgery in a safe manner when you sign up with us, and we'll guide you through the process. Let's see. Why surgeons don't do umbilicalplasty? I mean, I don't know. We always do umbilicalplasty. I don't know which surgeons are you talking about, but especially when we do tummy tucks, you know, everybody gets an umbilicalplasty. So I'm not understanding perhaps the question, but I don't know. Maybe why not all the surgeons do it, but we'll do it. Need an RN assistant. Well, we include the assistant for you when you come here, but you need to bring a companion that is 18 years or older, that can help you throughout the stay, along with the assistance that we're going to provide for you for the first 2 or 3 days and 30 hours through those days. Since they are not going to be with you all the time, you need somebody to be with you all the time, and there's the beautiful hotel has more than enough comfort for you and a companion. Now, if you're bringing more than one companion or an extended family, they need to get a separate room, at least for the first 4 or 5 days, just because no pets and no really kids. It's kind of hard if you bring kids, and if you do, then make sure they book a separate room. We can help you with that if we know in advance with enough time. So let us know. And again, your coordinators are amazing. If you don't know who is your coordinator or how they look, you can always go to our website, and we do have an area there, that talks about us here, and then you can see all the pictures of all the staff here. So if you don't know how Sonia, Melissa, Jennifer, Lindsay, who are they, you can always find them in our website. And then just put a face to the name.
You're asking how much is the stay premium package? The premium stay package is $21.99. So it's actually amazing for this price, for everything includes. It includes, again, 7 days, 6 nights, recovery assistant for 30 hours, improves the hotel transportation, to and from the clinic, and then the massage, 3 massages, and then the visitations, and and includes a lot of stuff. And also remember that we have that Pro Care package. The Pro Care package is amazing because it will include things that you might need, like extra visitations and maybe like IV therapy or IV fluids that you might need after surgery, or even if you have to go back to surgery within the first 2 or 3 weeks for whatever reason, which is unusual, but it might happen, then that should be covered by the Pro Care package. We're not talking about something that is a revision, a year later or 6 months later. We're talking about something that is related immediately to surgery, and that will cover all of that, including like extra IVs, extra medications that you might need, even at the hotel. Or if you need like a blood transfusion, we can give you the blood transfusion here at the office. So, and that will be included if you do the Pro Care package. Otherwise, it will be more expensive. Do you lipo the inner thighs with tightening? Yeah, definitely. If you're a good candidate for that, we definitely try to address the thighs with lipo and J plasma is possible. That's the best way, because the thigh lift is kind of hard to recover from. So we don't like going straight for the thigh lift if you can avoid it. So if you don't have a lot of excess skin and you have some fullness and your skin wraps and things like that, you are a great candidate probably for liposuction. And then J plasma helps a lot with the skin tightening. So just send us your consultation, topaesthetics.com, and then find out, here we're gonna just check topaesthetics.com, go to the free consultation link, and we'll send you DM us, and we'll send you the link if you can find it, just to send the pictures. Now, we are working in some cool projects coming up, and one of those projects, is it uses a little, it's not a little, it's actually a pretty interesting artificial intelligence engine that we have designed in order to make decisions for you. So the consultation process will be quite cool. So we are working into that, and we should have it ready within the next month or so. So you will get likely a quote right away. And we have been testing it, and it works very nice, very accurate, So we'll tell you more about it once it's up and live, but your consultation process is about to get amazing. It's really, really cool and fast. So you will get a quote within minutes, and that is pretty amazing. So we are all very, very happy about that, and we're hopefully in July, latest August, you will be enjoying a different kind of process with Top Aesthetics, even better than what it is now, which is pretty cool. What is now is us.
How do you treat fibrosis during tummy tuck and from prior lipo? Fibrosis is always a tough issue. We can always do some ultrasound cavitation massages. All of those things help to loosen up those areas of fibrosis that are left after tummy tuck or poorly performed lipo. So some patients that have issues with that, they may need either another tummy tuck, which I have done, or just to stretch in the skin to loosen all that fibrosis from the underneath. So it will be really a matter of looking at your particular case and seeing how it is, and see what's the best for you. Where do we send pictures for a tummy tuck consultation? In our free consultation link. So on the Instagram bio link, you can always go to our website, topaesthetics.com, and go to the free consultation, fill out those 10 questions that you find in there, and then there's an area to submit your photos. So that's the first step. I will be looking at some photos and consultations that we got today after the live here, and then you will be getting the consultations and the quotes after I review the cases, or Dr. Morales or Dr. Ascari reviews the cases. The good thing about here is that we will review your cases for you, and it's about to get better. So
Okay, one more thing that I want to
yes,
say.
what's up, Ceci?
I want to say this. Hold on, I have to get behind you like this. I'm like your guardian angel, because otherwise I don't come out in the camera. It looks like I'm not here.
She's here.
Guys, yeah, I'm here. I know that it's frustrating for many of you to not be able to have your companion down here when you get surgery.
Oh.
He cannot or she cannot wait here in the waiting room.
There's many reasons for that, and I tell you the reasons for that. It's for your sanity and his or hers. It's you don't have to make the situation more stressful than what it is, and there's no business for your companion here at the office. They only are an obstacle and a subject of stress. So if you're coming here the day of your surgery, this is why we have designed this system. And actually, we started doing it, with the COVID restrictions and all that. But your companion will stay at the hotel, resting in the comfort of their own room, watching Netflix or just getting some rest, because they're going to be busy after your surgery, and they're going to need to do that and help you up at that point. That is where your companion is helpful. Coming here, our driver will pick the patient up in the hotel and bring him here. And then here, as soon as you get here, you're going to be placed into the room to start the preoperative process, put the IV, put everything. So your companion will have no place to stay here, other than waiting, sitting in the waiting room, just alone. So might as well just wait in the comfort of their own room at the hotel.
Can I say something?
No.
I know. Listen, I know what it is to go through surgeries. I had a lot of surgeries, unfortunately not plastic surgery, but I had injuries from sports. And I know the concern of the other person waiting for somebody that is in the operating room. And I'll tell you this, that creates a lot of anxiety for everybody. And I want to say one thing, that if I would get surgery right now, I would like to hear this. He has operated more than 8,000 women plus. Nothing has ever happened. Nobody ever died. So numbers don't lie. It's statistics, right? We all measure everything with numbers, the facts. Nothing ever happened, and you need to trust that.
But it's not about, of course that's important, but I think it's the person waiting here is not gonna make anything any better, neither for them or for you. So we have done this, and you have this experience doing this for many, many years, and we believe me that this is the system that you want to be at, because it's going to be more relaxed for everyone. And again, we're happy to connect with them before and after the surgery, so it's definitely, important, but not the fact that are here.
Can the husband sleep in the same room than her?
Oh yeah, of course, your significant other will be in the same room at the hotel, if he's the one taking care of you. And yes, and as you saw, we just had a patient, come in here in the live right now, and she was saying her husband, although he could sleep on the same bed that she wanted, he chose to sleep on the sofa pull-out bed that they have, the sofa pull-out couch, because he was more comfortable there. You might remember that you have pads and things in the bed that you are, and the recovery assistant is also coming in and out just to help you and checking your vitals and things like that. So, but of course they're gonna stay with you in the same room and everything else. And we need them there because they need to help you. So bring a good companion. Don't bring, your 80-year-old, grandfather that, or your, 12-year-old kid that, you laugh, but that's exactly what happens. We got patients bringing dogs, other type of pets, young kids, and people that is over 80. Listen, they have to help you. We don't provide the help for you and them. Like they need to be really, they need to be here, understand and help you. Husbands and guys are not kind of the best. Hey, it's 6 o'clock, so we are gonna be cut probably in less than a minute. So we already cut on the
top
the top aesthetics. So anyway, if we did not get to your question, then DM us, and we're happy to answer it to you. But we are gonna get cut here. So let's see. We will do this again every Tuesday. I hope everyone was able to log in here in the multi-platforms, and I'm looking forward to see how this turns out to be at the end. So thank you so much for tuning in, and I'll talk to you very soon again. Thank you. Adios. Okay, here, and we